A new study says the coronavirus has caused more than double the number of deaths that have been reported. An analysis by the Institute for Health Metrics and Evaluation, or the IHME, finds COVID-19 has caused 6.9 million deaths globally. They say deaths are significantly underreported for every country. The IHME also finds the United States has had more COVID deaths than any other country. Their analysis finds more than 905,000 deaths, compared to the CDC's reported more than 576,000 deaths. CDC Director Dr. Rochelle Walensky was asked about this at the White House coronavirus briefing earlier today.
We've known that the toll of this pandemic is not necessarily just those who've passed from COVID-19 specifically, but excess deaths relating to access to care, not presenting to care, and many other things. So we will look at this carefully, and then we will work within the CDC to make decisions as to whether to count them as excess or to count them as COVID specific. Regardless, I think we need to understand that the death toll of this disease has been attributable directly from COVID, as well as the collateral damage, I would say, of what has happened from COVID-19. And that, in my mind, is just more and more reason to continue to get vaccinated.
For more on this, I want to bring in Dr. Christopher Murray. He's the director of the Institute for Health Metrics and Evaluation at the University of Washington School of Medicine. Dr. Murray, welcome. It's great to have you with us. So tell us how you and the Institute for Health Metrics and Evaluation came to this conclusion that COVID deaths are so vastly underreported.
So what we did is we looked at all the countries, states, provinces around the world where we have access to weekly death data from all causes. And we looked at what happened in 2020 and the first few months of 2021 and compared that to the number of deaths you would expect to see in a given week based on the data in the previous years before 2020. And that gives us a measure of how much the death rate went up. And that also gives us a way to think about the total impacts of COVID. And that's how we come to the conclusion that depending on the place, there's been quite a lot of under-reporting of the impact of COVID.
In some ways, I think that your work just sort of reinforces what many people suspected, right? That there were so many cases of, of either sicknesses or deaths that never were recorded properly, maybe never even made it to the hospital. So, remind us why it's important to know the accurate death toll. I mean, obviously, we all want to know the facts, and it's important to be accurate, but especially in a pandemic of this scale, remind us why this is so important.
Well, there's several reasons why it's very important to get the numbers right. First, in some parts of the world, the magnitude of the epidemic has gone tremendously underreported. So, for example, in Eastern Europe, in Russia, and Central Asia, there are some places where only 1 in 10 COVID death has been reported. And so there has been a sort of silent, huge epidemic in some parts of the world that we're missing. Even here at home in the U.S., it matters because if, each state is a bit different. Kentucky had much less reporting or a lower reporting rate than other states. But it matters because we need to understand when transmission of the virus occurred so that we can trace back and understand the impact of different strategies. For example, the social distancing mandates, the effective masks, all that will matter very much to understand when and where the epidemic had its toll, especially even as with vaccination, as we think there may be risks later this year that new variants can come back. And so we need to be well armed to understand the true impacts of COVID.
So what do you hope people will take away from this information? And is there a chance that the official toll, that the CDC toll could be revised based on your work?
Well, I think that the highest level is that COVID has been one of the most deadly health threats in the world that we have seen. It's starting to rival the Spanish flu from 100 years ago. And that's important to understand. The epidemic is certainly not over, and we unfortunately expect 2.5 million deaths globally between now and September 1st. And so, that's message number one. This is a very bad disease. It's continuing to have a huge death toll in around the world. I think message number two is that we should do everything in our power, and vaccination is the most important strategy, to make sure that we don't continue to see more deaths from COVID here in the U.S. or in other countries. And as we see new threats, like the new variant in India, we have to recognize that the epidemic's really not over, even though I think many people wished it was.
Well, Dr. Christopher Murray, thank you so much for sharing your very, very important work with us. We've been covering COVID, obviously the coronavirus, for a very long time here on CBSN, and I have to say that your work really just bears out, I think, what a lot of us have long suspected. So thank you so much for joining us. We appreciate it.
Thank you very much.